Welcome to the full arch scanning powered by iTero Element intraoral scanner. To complete the scan, you should scan the lower and upper arch and the bite. You can also invert the order, starting from the upper arch. Please note that even in cases where you need additional aligners in one arch, we highly recommend scanning both arches to provide as much information as possible for fabrication of the new aligners. Remember that the teeth are in contact and both arches are moving as a product of the Invisalign Clear Alignment therapy. It is also important to scan both arches to enable the user to keep track of changes using the iTero time-lapse technology. Before starting the scan, confirm that the teeth are free of excess saliva, use your fingers to retract the cheek, and place the wand flat on the occlusal surface of the teeth. This patient has their third molar present. That tooth is the starting point. Once the location of the starting point is confirmed in the viewfinder on the distal molar, turn on the wand and scan the occlusal surface of the lower arch in a single continuous motion. When you reach the bicuspid, continue by swiping across the anterior, tilting slightly to the lingual at the contralateral bicuspid, and then proceed by moving the tip straight back to the contralateral terminal molar. This will allow capture of continuous segments of anatomy. Repeat the step on the contralateral side. When scanning the lingual area, bring the cable end of the wand out to the side and maintain the wand tip at a vertical 45-degree angle to the lingual surface. Both sides of the sleeve should touch the teeth. Retract the cheek as you move anteriorly and make sure your sleeve is steadily touching the teeth. Continue scanning by rolling to the lingual and capturing the lingual anatomy of the entire arch. Holding the wand tip against the tooth will help to retract the tongue. Twist to capture the interproximal anatomy while you scan. When you have completed the lingual, rotate to the buccal and use a rocking motion as you move toward the anterior to capture the interproximal anatomy of the buccal. Place the sleeve at a 45-degree angle to ensure that you capture some of the occlusal as you scan the buccal. The scanner sleeve is your retraction device when scanning the buccal area. When you cross the midline, move the wand tip to the opposite terminal tooth. Switch hands to hold the wand when scanning the anterior teeth and keep the wand in a horizontal position. Moving from posterior to anterior on the buccal reduces interference from the cheek and provides a smoother scanning experience for you and the patient. Next, capture solid anterior incisal anatomy by placing the wand so that the cuspid and the lateral are centered in the viewfinder, and then roll from the lingual surface over the incisal edge to the facial. Repeat the step on the contralateral side. These images show how to position the sleeve on the incisal edge to roll and capture the anatomy. Retract the lip to leave room for the sleeve to move. There are two strategies for capturing missing anatomy. Use the scanning feedback feature, which detects the holes and provides a color. Red in monochrome and purple in color mode, indicating the area that needs to be filled in. The second option is to simply proceed to that area of the missing anatomy and add scans to that spot. Now we will switch segments by tapping the directional arrow to switch to the upper arch and scan with the same protocol. We start scanning from the occlusal at the last present molar, and in this case is a wisdom tooth. Move across the posterior teeth in a U-shaped motion. When you reach the bicuspid, continue by moving across the anterior, tilting slightly to the lingual at the contralateral bicuspid, and then proceed by moving the tip straight back to the contralateral terminal molar. This will allow the capturing of continuous segments of the anatomy. Continue scanning by rolling to the palatal and capturing the palatal anatomy of the entire arch. Bring the cable end of the wand out to the side and maintain the wand tip at a vertical 45-degree angle to the lingual surface. You can visually identify that you are at a 45-degree angle if you can see some of the occlusion and the palatal surface in the viewfinder. To capture the mesial and distal interproximal anatomy, twist the wand right and left as you move around the arch. Next, scan the buccal while holding the wand in a horizontal position. Use a rocking motion as you move toward the anterior to capture the interproximal anatomy of the buccal. Bringing the cable toward the arch will capture the mesial interproximal anatomy, and taking the cable end away from the arch will capture the distal interproximal anatomy. Keep the wand in contact with the teeth in the same way that the bristles of a toothbrush are in contact with the teeth when brushing. When you cross the midline, remove the wand and then place the tip on the opposite terminal tooth. Use the same rocking motion to capture the buccal surface from the posterior to the anterior. Moving from posterior to anterior on the buccal reduces the interference from the cheek and provides a smoother scanning experience for you and the patient. Next, capture solid anterior incisal anatomy by placing the wand so that the cuspid and lateral are centered in the viewfinder, and then roll the lingual surface over the incisal edge to the facial. Repeat the step on the contralateral side. These scans help to verify that the lingual segments and the buccal segments are joined with accurate incisal surfaces. This step is critical for properly fitting Invisalign aligners. After completing the upper scan, I noticed that there was missing anatomy on the mesial lingual of the tooth. To capture the missing anatomy on the upper lingual mesial, start by bringing the cable end of the wand out to the side you are scanning, and then use a twisting motion to fill in the interproximal. Twisting the wand back will capture the distal. Once you reach the bite segment, each side of the bite is regarded as a separate segment. You therefore need to turn off the wand and change sides. Next, ask the patient to open their mouth and use the wand to retract the cheek. It is recommended that the patient is sitting to take an accurate bite registration. Have them close in a record of the bilateral bite from the patient and the relationship the clinician wants to treat or restore, and position the wand tip gently against the tooth anatomy while observing the occlusion in the viewfinder. Moving forward in a small wave-like motion, capture 3 or 4 teeth. Then move to the contralateral side using the same technique. You finish the scanning process. Tap View Mode icon to review the completed scan. There are several capabilities for a better experience reviewing a completed scan. The occlusogram is the color representation of the contact areas between the arches. The arches in red indicate full contact, and there are 3 scale options available on the scanner. Being able to display the occlusal contact allows the clinician to evaluate the patient's occlusion. The clinician can then educate the patient about their oral conditions with a clear visual aid. The color icon allows the user to toggle between color and monochromatic modes. This applies to both scanning and viewing all case types. If an attachment or other appliance remained in the mouth unintentionally when it should have been removed prior to the scan, it can be removed virtually using the eraser tool to fix that specific area. First, tap the eraser icon, and then using your finger, draw a circle around the large area on the model that includes the content which needs to be removed. It is very important to rotate the model to confirm that the correct content has been removed. Then tap the wand icon and rescan the area. Information required for the Invisalign case type includes the following: 2 millimeters of gingival tissue, solid incisal edges on both the lower and upper jaw. These scans help to verify that the lingual segments and buccal segments are joined with accurate incisal surfaces. This step is critical for properly fitting Invisalign aligners. The interproximal anatomy is critical for best fit aligners. A record of the bilateral bite from the patient in the relationship the clinician wants to treat or restore the case. Also, review the models from the buccal and lingual. The distal surface of the last present molar should be complete to ensure that the aligner fits properly. Once you confirm that your scan fulfills all the requirements, tap the envelope icon to send the case. It starts with iTero.